Aloha. Hau'oli makikiho. Friends, happy new year. Welcome to Hawaii Care Choices Healthcare Talk Story, our first in 2022. I'm Tish Lopez, your moderator this morning. Thank you so much for joining us on this beautiful Aloha Monday. Before we get started, we want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel. Simply search Hawaii Care Choices. For those of you joining us on Zoom webinar, the bottom of your screen should look like this. Please click on the chat box and say aloha to everyone here and let us know where you're joining from. Healthcare Talk Story is now an interactive presentation, and we'll be asking you questions throughout the presentation. So please raise your hand, use that middle button there to send us feedback. Lastly, click on the Q&A box at any time to submit your questions to our panelists. To those of you watching on Facebook Live, thank you so much for joining us, and aloha. Please use your comment box to say aloha and let us know where you're tuning in from. Feel free to chat in questions as well as share your reactions with us during this talk story using your reaction buttons. We love to see those hearts and thumbs up and even the care button. Again, the talk story is an interactive presentation and we want to hear from you as well. So just enter it right there in the comment box. We are also doing polls today. For those of you watching on Facebook Live, you will not see the polls pop up, but we still want to hear from you. Feel free to put your answers right there again in that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. Now, polling is very simple. A question will pop up similar to what you see here on your screen. Please make the selection that you think is best and submit your poll at the bottom there. Again, no right or wrong answers. We welcome just your participation. Just to kick things off and get you comfortable, let's try with an icebreaker right. So the question on your screen, friends, if you could be one of these mythical animals, which one would you be? A dragon, a unicorn, a mermaid, or a sphinx? Again, go ahead and click the answer that you think you would like to choose and click the submit button below. I see we have a few coming in. Thank you so much. Again, those on Facebook Live, put that right there in the comment box. Would you rather be a dragon, a unicorn, a mermaid, or a sphinx? I'm going to go ahead and end the polling right there and share our results. So 67% of you said dragon, 11% of you said unicorn, and 22% said mermaid. 0% said sphinx. Well, that is all, friends. Super duper easy, and you guys got it. It is going to be a wonderful day. Great job. Now I would like to introduce you to our speakers today. Oh, we have Lani Weigert, Community Relations Manager for Hawaii Care Choices, and our wonderful presenter on all of our presentations. If you are on Facebook or Zoom and heard Lani talk before, send her a comment or chat in hello, give her some hearts. Aloha, Lani.
Aloha, everyone. Good morning. Thank you for joining us.
We also have Dr. Akiona, MD, Family Medicine Physician. Aloha and welcome, Dr. Akiona.
Good morning. Sorry, I just saying hi.
No, not at all. Good morning. We also have Lisa Rantz, Hawaii State Rural Health Association and Executive Director of Hilo Medical Center Foundation. Aloha and welcome, Lisa.
Aloha. Happy Monday, everybody.
Happy Monday to you. We will begin our talk story with Dr. Akiona, and then we will hear from Lani Weigert on our Hawaii Care Choices programs. And last but certainly not least, we will talk story with Lisa. Friends, if you can give a warm virtual welcome to Dr. Akiona, family medicine physician. Dr. Akiona is a Native Hawaiian community-based family physician and researcher. As a part of Premier Medical Group Hawaii, she leads the community outreach and clinical operations, which includes mobile health services and street medicine program, focusing on both primary care and COVID. Dr. Akiona, you definitely go beyond the conventional type of a family physician. Can you please elaborate on what you do and how you got into this method of providing care?
Sure. I know, I think I wear a lot of hats, and I think for a lot of people. It's kind of, so for my mentors back in Pittsburgh, I went to medical school in University of Pittsburgh, and I knew coming back home that I was going to come to what we know is kind of a difficult healthcare resource area. And so all of the specialty training that I got, I essentially approached it that way. I was telling them like, hey, can you train me as far as you would possibly want your family medicine / internal medicine colleague to go? Like would you want me to refer to you? And then, but otherwise, what would you want me to kind of manage? And that's how they trained me. It was very fun because they were like, oh, this is cool. You know, I'm going to train you as far as I would like, you know, want my other colleagues to go. And, you know, I told them I have like a vested interest in kind of providing the best care possible because this is home for me. So coming back, I knew I wanted to be as useful as possible. And then it's just over the past few years been finding a position where I could actually utilize as much of my skills as possible. So kind of, you know, and part of the skills I think took me time to understand was my upbringing, right? So like I was raised in a family that knew both sides of the spectrum for the socioeconomic status. We knew what it was like to struggle and we knew what it was like to succeed. And then, you know, our model or like the way we were raised was always like, don't forget about the times you struggled. And when you're succeeding, make sure that you don't leave people behind. And so I think that that's actually an underappreciated kind of skill set that a lot of us local kids, we were raised that way. And so one of the beautiful things about Premier is even before the pandemic, you know, we had a vested interest in the most vulnerable and the most marginalized, and providing them the best service possible because, you know, I think I'm finally at a place where my colleagues agree that everybody deserves integrity. You know, just to look them in the face and kind of make them the same promise I would make my family. Like I'm going to give you the best care I can, and we're going to bust our butt no matter like who you are, where you're from. And I think at the very basic level for family medicine, if you're able to kind of operate from that level, like being resourceful and being kind of broadly trained, if you can come from that place, it really makes a huge difference in how you operate just day to day, because, you know, you're not having to make triage decisions based on things that really shouldn't matter, like ability to pay or, you know, ability to find your own resources. So I think it's kind of an odd thing, but, you know, I do street medicine, I do clinical medicine and do primary care. I consult a lot, try to help people kind of figure out where they have to go. And then I do a lot of COVID. So, I mean, you know, from education to treatment to testing to you know, vaccinations and everything in between. We've been doing all of it.
Wow, that is amazing. And it's so nice to hear, you know, your humble beginnings as well, but that you came back to the Big Island, to home, to really give back to your community as well. I know you mentioned working with folks on the streets. What challenges do you deal with, especially during COVID right now?
Yeah, you know, so COVID, and I believe I've said this, if people have heard me talk before, it really just kind of shined the light and really kind of emphasized all the weak points in our care system that we already knew existed. And so, you know, with people who have problems with shelter, with stable shelter, it's the continuity of care, you know, and so it's a lot of it is just getting them hooked into resources, the appropriate resources that'll help link them to other resources. And then kind of really emphasizing that healthcare is more than just getting them to the doctor's office. Some of it is really getting them stable housing, someplace to get good food, someplace to you know, if we're asking them to do good hygiene and asking them to wash their hands and kind of social distance, like providing them some form of structure so that we're not just kind of asking them to do something without showing them a little bit how to do it. I mean, it's majority of the times on the streets, it's going to be wound care and mental health issues. Those are like the two, you know, most common. The rest of it being kind of lost to follow-up. So a lot of them have not been able to see or establish with a primary care physician. And so maybe they have some medical history, but they've been getting all their care through the emergency room. So that's been the biggest challenge.
Yes, I, you know, can definitely imagine. And I just thank you again for providing that service. From a compassionate perspective, I know you touched a little bit on the different types of care that you give, but what would be important for us to understand about those who do live on the streets?
You know, I think one of the biggest things for me was kind of the realization that a lot of them look a lot like my family, like me. So I mean, I don't know if a lot of you guys, like, I have a lot of like uncles who are kind of, like they're kind of those funny uncles that just crack us up. They do off the wall kind of stuff. There were always cousins and parts of our family that, you think kind of live on the edge, and we worry about them a lot. And so those are the people I take care of. So I always think of those people as like, I mean, they're just like my family, and it's become more evident that they are forgotten. I mean, it's just one of those, like, we just don't want to look at it. And I think that's the hardest part is, we provide the care in the moment. We do all the, education we can, try to link them to really, really good. We have some of the best crisis workers. We have some of the best outreach workers. I mean, and these workers like follow up on their personal time, try and make sure they're okay. But then, to sit back and think like that's somebody's sister, that's somebody's daughter. A lot of times it's families now. So that's somebody's grandchildren, and it's just, it's frustrating, I think. And then it's just kind of balancing that, right? Because I mean, just when I have to report back to say like the ledge or to different funders, and I'm telling them like, this is a young at-risk population. A lot of them are Native Hawaiian. A lot of them maybe have some history of mental health issues. We can't look away, because this is essentially like, our family, these are our family. And I think a lot of times the assumption is that they don't want to get help. And I challenge that directly, because I think, when we, even the most difficult ones, when we kind of consistently show them that we're going to show up and we're going to be there and we're not going to leave and, like leave them there, eventually, they engage in their own way. And I think that's the key, is kind of like bringing the care to them and understanding that they're not going to engage the way that you expect them to all the time. But, we do our best to just be consistent in our approach and just be, you deserve care, and you deserve resources, and you might not know how to ask, but that's how we're gonna approach it from here on. That's been kind of the hardest challenge, but also kind of the most rewarding, I think.
That is such a wonderful insight. Thank you so much, Dr. Akiona. Being involved, like the rest of the world, really, in providing massive COVID testing and vaccines, especially with here on the Big Island, what is one of your main takeaways from that experience?
So I think probably one of the biggest things for me has been how close all of us are to being vulnerable, right? So I think that it's easy for us when I ask, what do you define as vulnerable or marginalized? And it's easy for us to say, kupuna who don't have family support, or homeless people, or, the single mom with no resources. That's easy. But it's harder for us to understand that simply by living on the Big Island, or simply by, choosing to live on the outer islands, we actually become vulnerable. Like, we become marginalized in a different way. And so it's the access to quality care, to like good information, good education, and all the resources that tend to be a little bit more concentrated in Honolulu. We actually become more vulnerable and marginalized. And then it's just like helping people understand that is not, it's not a final sentence. Like, this is something that we can advocate for. So this is something that now we have to try and change, but it's ingrained in us to like take care of each other. And so it's one of those things, like, there's nothing wrong with the community mentality at all. Like, we're so good at taking care of each other, but it's okay to ask the government, like the county and the state, to just kind of shoulder it a little bit more. And that is the hardest part, because one, we got to understand our vulnerability and how marginalized we are, and the kind of how tenuous our situation is, just in, feeling like we're pretty comfortable, but then also just like being comfortable now asking for better care. And I think that's hard. Like, that's hard for all of us throughout COVID. That's been my main takeaway, I think.
Yeah, awesome, wonderful. Thank you so much for sharing that. Amongst, probably COVID being the most serious, but what are your other top 3 serious illnesses of people that you meet on the streets, or whether in your office? What is the 3 top serious illnesses that you see, and what are the barriers to get them care?
I would have to lump them in, I think. Honestly, it's going to be more of the mental health stuff. So a lot of people, I mean, it's kind of been more concentrated since COVID started, but the depression and the anxiety definitely in the regular population as well has kind of gone off the charts. So I'm definitely having to treat a lot of people, they've lost loved ones, they've been isolated, so they don't have that physical touch as much anymore. A lot of their people just had struggled. So I think mental health in general has always been kind of one of the big hard ones. The second being some of that mixed in with substance abuse issues. And then I think most commonly it's going to be my trifecta, which is the diabetes, hypertension, and cholesterol. So it's like, those it's so sad that we call them our bread and butter, but it really is just, regular people. Our care has been interrupted. We've been trying to figure out ways to, telehealth has been working, but, my job is to kind of make sure that we're not skimping on quality, because you can provide telehealth in a really good way, but then, we're missing a lot of people. And so it's because all of these diseases now have downstream impacts on, your stroke risk, your heart attack risk, your, just all of the different specialties that we already are struggling to keep up with. And so those are to me the most difficult, but majority of my struggle in general for primary care has been coordination of resources. So it's just trying to get them, get their meds covered, get their meds mailed to their house, get case management. That's been, it's not a diagnosis per se, but it has been the biggest challenge on primary care in general, just coordination of services.
Well, that definitely leads me into the next question. Thank you so much for touching on that. What is the biggest challenges in serving our Native Hawaiian, our Pacific Islander families, even our Asian communities outside of, everything that you kind of just named? Is there anything specific or, is it in addition to?
And I think so it's still going to be that coordination issue, but I think over time I've come to realize, so it's like something that we kind of learned or figured out, right? So when I was a researcher before I was a doctor, and the question I was handed this question. It was, why are Native Hawaiians so bad at following up for cancer care? And so part of it is realizing that the system kind of is skewed in a certain way that kind of makes it really difficult for certain populations to access care and then to follow through. Some of it is cultural, and some of it is built into the system itself, where there is like some intrinsic bias. And we're seeing this in COVID care. We're seeing this where, the different populations, specific populations, carry disproportionate burden. The death rate is higher in Native Hawaiian and Pacific Islanders. Where we see this in the Black population in America. So, I mean, that's kind of one of the systemic things that we as an entire country have to face. The other part is like that more subtle cultural stuff. And so for me, it's been really encouraging people to speak up, because we were trained and we've been so good at just, we're so polite. And I tell people in my regular, and any of my patients will tell you this, I'm like, okay, local people are so polite. That means that if I say follow up in 3 months, they're going to wait 3 months. Even if they're struggling, they're going to wait for 3 months. No, doc said wait 3 months. I tell them, please don't do that. If you need something, please call me, because we're trained to be polite. And sometimes asking for help doesn't always look polite, and you're going to feel shame and you're going to feel like you're burdening me, but that is not burdening me, And so like helping people, we've been raised by generations that survived war and drought, and they remember what it was like to struggle, and they do not want to make trouble. They don't. And I have to like remind them, like, you're not making trouble by just asking to exist. Like, that is not, like you don't need to worry. And I think that has been the hardest thing when it comes to stuff like palliative care, hospice, just advocating for themselves. And then I know that that's probably what makes me the most tired and cranky, is that I'm like, oh my God, I have to advocate, I need these people to be seen. So if you ever see me and I'm kind of on fire, that's probably what's going on, is I just want people to be seen equally.
Yeah, absolutely. Thank you so much for sharing that, wonderful point. And I completely agree. Local people, we are polite. Lani says these throughout her presentations, if any of you have seen her talk. And it really is relearning that we can ask questions, that we are able to be our own advocates and to reach out. And it isn't being a burden. So thank you so much, for for putting that out there, being our echo as well on that. I just have one last question for you. I don't want to take up any more of your time. I so appreciate all of your great insight and points. What are some of the care gaps that you've been witnessing in our community? Again, I know you've talked about so many, so many. And I think you highlighted a lot, but is there anything else that you wanted to add to that?
Yeah, no, I think you could have a long talk, just a talk series about the gaps in care. And I think, it is a balance that I have to manage between the doom and gloom that keeps me up at night, and then the reality of how much I can actually address, like as a single person. And so Hawaii County is the third worst in the nation when it comes to provider shortage. And so that is really important for people to understand. So people who have seen my face everywhere, it's not because I am like, the most popular person. It's literally because there's not many of us. So there's very few of us doing what we're doing. And, the primary care is one big point to it. So the coordination of services, a lot of our specialty care just doesn't, we are making do with the bare minimum. I mean, just regular hospital services, you look at how much people we have on island and how many beds we have, and it just blows my mind. I mean, just on so many levels, just the basic infrastructure to care for this population. Even, so as a family physician, we deliver babies, we take care of, from birth to death. And so when you think of like what kind of services we have for neonates, for pregnant women with diabetes, for an aging family, it's just multi-generational stuff. We have so many care gaps. I think it's part of it is making sure that good intent, we have a lot of organizations and legislators with good intent, but it's just kind of helping them follow through. And like, what does that look like? And making sure that we don't skimp on quality just for a simple solution. And I think that's where majority of the indigenous people and the marginalized, we're always kind of cautious about that, because it's easy to skimp on care if no one is looking. And I think that's, I hate to say it, but that's what they get away with on the neighbor islands. And so, part of it, there are so many gaps in care. I mean, it's getting through something like a cancer diagnosis without having some problems in the coordination of care is the exception and not the rule. And to me, that is not acceptable. Like in 2022, that should not be the case, but it is, regardless of what race you are or what neighborhood you're in. At this point, it's really difficult to get well coordinated care in this state. So I'll just leave it at that and just say, like whoever wants to engage with us, I can use the help. Whoever wants to help me bother everybody, there's enough gaps that we can all have some homework.
That sounds great. Thank you so much, Dr. Akiona, just for coming on and sharing not only your beginning, but just what you've been passionate about and talking about our community and ways that we can understand a little bit about more where we are from, where we live. I just so appreciate it. Thank you so much. If you'd like to stay on, friends, if you want to ask Dr. Akiona any other questions, feel free to go and use that Q&A box down there, but we do not want to take up too much of your time. I appreciate it so much. Is there any last words that you wanted to say to our audience?
I just want to, if it's okay with you guys, I just wanted to give a shout out to my team. So Premier Medical Group has been kind of like busting their butts. I mean, both on Oahu, on the Big Island, across the state, and then across the nation, actually. And so I feel like, they don't hear it enough, but I really appreciate, the commitment to their community, because I feel like all of that kind of fire that I have in my chest, they feel it as well. And so, just Dr. Miskovich, he'll probably watch this later, but your people are strong, and I love them. And so it kind of keeps all of us going. And I just really appreciate all the community people, because they step up a lot. And, in times like this, it reminds me why we kind of make it through. It's generally because everybody just looks out for each other. And I know it's not going anywhere soon, but, we're all committed to like the next right thing. So we're just gonna keep on going. And so slow steps forward. If anybody is out in the community, stop by and say hello. If you have questions, please reach out to us. We just want to help however we can. And we might not always have the answer, but we'll try to find somebody who does. And that to me is what I would do for my own sister. So please reach out. And thank you for having me. And I love Lisa and Lani. Thank you.
Thank you so much. Well, we appreciate you. We appreciate all of the knowledge and insight that you have given us. And thank you so much for your time as well. Have a beautiful and happy Monday. Oh, I do see someone in the chat. If you would just like to answer that offline,
Okay.
that would be wonderful. Right now, I'd like to move on to our next presenter. Oh, so sorry. I'm reading just some of the chats. All right. We just want to say also, Dr. Akiona, in the chats, great points on the healthcare system, and everyone is just loving your insight as well coming from the audience. We are going to change up our lineup just a little bit. We have Lisa Rantz. I would like to call up Lisa Rantz onto our virtual stage. Everyone, please give a warm round of applause to her as she comes up. Good morning, Lisa.
Good morning.
How are you this morning?
I am doing great. So,
Awesome.
And I wanted to just thank Dr. Akiona for all of her passion. It's been one of my greatest pleasures kind of growing up with her in this healthcare realm through the residency program, and being able to continue to work with her is fantastic. So.
That is wonderful. Well, I would like to welcome you to our talk story, our first in 2022. For our audience, if you haven't, if you jumped on a little bit later, this is Lisa Rantz. She is a champion in recruiting healthcare professionals to our community, addressing the physician and nurse shortages in Hawaii County. And she is also going to share how that shortage is affecting our access to proper healthcare and what you can do about it. So Lisa, I know that your job is so expansive. Can you just please elaborate a little bit more on what you do?
Sure. So my day job is as executive director for Hilo Medical Center Foundation. I came to the foundation in November of 2014. And when the board brought me on, they wanted to expand on the community programming and provide support for the Hawaii Island Family Medicine Residency Program. So that was my first foray out into, sort of looking at our healthcare shortages, and then looking at, if we're going to support the residency program, then we need to develop the pipeline so that we have the infrastructure possible so that they can have gainful employment, right? We need providers in the community, but if they don't want to set up their own practice, then where can they go to work? And so, looking at that infrastructure is where I sort of started, right? So if we have doctors graduating, then what are those pieces that we need in place? And so the first thing that I looked at was a health profession shortage area designation, or a HPSA, because when our doctors graduate, they graduate with an exorbitant amount of debt, right? Unless they receive some sort of grant funding or scholarships, they're coming out easily $250,000 in debt. So I think the national numbers are closer to $300,000 in debt right now when they graduate from medical school and then on to their residency program. And so it took 2 years, but we did work with the Office of Primary Care and Rural Health to get the designation. We had some pocket designations, but we really needed a countywide. And then the countywide designation, it's a federal government designation. With the designation, then our doctors and nurses, basically primary care providers. So our licensed clinical social workers, our psychologists, right? So that goes to, our mental health needs as well, and substance use, which are, we're seeing the escalation during COVID. We had issues prior to that, but lowering payment becomes a huge deal. And then a 10% bonus payment to our doctors paid out quarterly. Well, nurses as well, if they're doing direct billings on their Medicare services. because we do have the lowest Medicare rate in the nation, which is criminal. So I'll just say that, but that's sort of what led me down the path to sort of expand and got me on the radar of our legislative body, our congressional delegation. Governor appointed me to the Hawaii Medical Education Council. So I have touch points with all of the residency programs in the state. Yeah, so all of these little things led to sort of that pipeline. And so we actually serve as the Area Health Education Center, or AHEC, for Hawaii Island. And that's federal funding that goes to the John A. Burns School of Medicine. And then we're the sub-grantee. So we have a health career workforce pipeline program. We call it our pre-health career core program. So we go out into the high schools and we recruit students into health careers. We have a book that lists the different types of careers, because not everything in healthcare is clinical either. And so, really looking at our shortages over the long term, right? So if you look at the physician workforce assessment that's been going on for more than 10 years, our shortages continue to get worse. And so to address that, we really need to raise our own, and we need to create an environment where we can bring our children back home, right? They're not kids after they go to college, right? Our young adults, we want to be able to bring our kids back. And in order to do that, we need to create an environment to where they can have their loans paid off and they can have a living wage, really, to be able to do the work that they do.
Yes, that is amazing. I did not know. So I am learning about this wonderful program that you guys have. I know you touched on it a little bit, but if you can explain to us, what is the current status of our healthcare workforce within Hawaii County?
So as Dr. Akiona stated, for Hawaii Island, we have the third worst physician shortages in the nation. And if you look at number one and number two in the nation, they're on the mainland. One is 15 minutes outside of Atlanta, Georgia. So they have access to specialists, they have access to providers. The second one is located an hour outside of another urban center. So they can actually drive. The problem with Hawaii is our geography, right? We don't have a geography that we can just drive to the next specialist or the physician that we need to see. We're experiencing extreme delays in referrals to specialists. So there's no easy answer, but we need to do something besides research it. We need to do something besides continue to report that we have the third worst shortages in the nation, that we have an aging workforce, right? More than a third of our current providers qualify for Medicare, right? So, it just makes it very difficult to do that. And we actually launched a project, a comprehensive community health needs assessment. We're starting in Hawaii County. We're working in collaboration with Community First, so they're the lead on this. We did pull in the Department of Health. We got funding from the Centers for Disease Control. We're working with FEMA. So, this is a huge project. We're going to be rolling out to the rest of the neighbor islands in rural Oahu later on this year. But I would encourage the folks on this call to reach out. Would love for them to participate in one of our focus groups. So we're getting ready to wrap up the focus groups. We did a community survey in the month of November. And, not surprisingly, the preliminary findings on that are access to care. People can't get into an appointment when they need one. They're not able to see a specialist. A third of the people that answered the survey have to fly off island for care. And it's not what our community deserves. And it shouldn't be that as people age or develop, a heart condition or get cancer or other chronic conditions, that they have to consider leaving the state in order to survive. Our populations are sicker on the neighbor islands, especially Hawaii County. We're looking at social determinants of health with not having transportation, not having electricity, right? So, if you don't have electricity and you're running off of a generator and you don't have the gas to put in the generator, then how are you expected to take your insulin to control your diabetes? And so, really working with these programs and, with the work that Dr. Akiona does with the street medicine and the paramedicine, to really outline those things in a way. Healthcare is very complicated, but if we can sort of siphon it down into these puzzle pieces to where we can say what support we need from our legislative body as far as policies, right? So what can they do to help that? But then looking at our organizations and how our healthcare organizations can work collaboratively in a system to be able to really meet the needs of our community members is what we're working on with this survey.
That is such great information and such a need that we do have in our community. I know Dr. Akiona touched on it as well, and the kind of the resources that we would love to have here, but we don't have access to all the time. I know you touched on a little bit of what we need, and we understand that you have been trying to close the gap on needing more physicians and more nurses. What would you say is the status on that need? Do we need more doctors, more nurses, both? What would be your opinion on that?
We need both. We have a shortage with all areas of care. So yeah, it comes down basically back to the infrastructure. So if we don't have a high enough reimbursement rate, we also have the general excise tax that's a heavy burden on our solo and small practices. The federally qualified health centers and the hospitals don't pay that. If they were to pay it, it would put them out of business. But yet we shoulder that burden on our independent practices and our physicians. We are the only state that taxes healthcare. And we have talked with community members through our community health needs assessment, and they have to decide between putting food on the table for themselves and their children or getting that preventative scan that will diagnose their cancer early. And that's not where we should be. Hawaii has done an absolutely fantastic job with getting everybody access to healthcare, right? Or getting healthcare insurance. But just because you have healthcare doesn't mean that you can get in to see a physician. And so having healthcare does not equate to having access to healthcare. And so we see that access is the problem.
That is such a great point that you make, Lisa, and I definitely agree with you as well. This question comes from Andrew in the audience, and how can we be more helpful in the community, but not only recruiting, but retaining doctors and nurses?
So I think, from the community perspective, we have to be accountable for our own health, right? So we have to take care of ourselves. We know that we don't get enough exercise and we loves our 2 scoops of rice and mac salad, right? We have to make healthier choices. And I'm guilty of this myself, right? But we do. We need to, get back out and do the walk with the doc. It's hard with COVID, right? We need to be able to get exercise. We need to control our stress. All of these things are very difficult, especially during COVID, because it's so uncertain and it puts such a burden on our mental health to be facing the things that we're facing right now. And then just the numbers that are spiking right now. And thankfully, we're not seeing as severe of disease, but it's still pretty significant. And yeah, I think you need to take responsibility. You need to advocate for yourself. You need to help those around you with the navigation of the healthcare system, because it's very difficult to navigate. And then the other piece is, reach out, get involved in this access to care project that we're working on, have your voice heard. And then we'll be sending out emails to reach out to the legislators. And in the outreach that we've done so far to our state and congressional delegations, is they love that this is a patient first perspective, right? This is the community. This isn't, we did talk with the providers as well, because that's very important. And they are also consumers of the healthcare system. But when we bring up things like that tax, how does that cost affect access from the community side? So we'll be asking you to lend your voice to that.
Wonderful. And I would like to just go back to the chat. Dr. Akiona did say that was a great point that you made. And a lot of us are insured, even she was saying the homeless, the vulnerable, and the marginalized are often insured, but there is no access to good care. So she'd just like to say thank you so much for putting that point as well. And again, I agree with you. Well, that is all of the questions that I have for you, Lisa. Is there anything else you want to say to our audience?
I just want to thank our community. I think, East Hawaiian Hawaii Island has the best relationships, and which is why we started this project here, because we can work out all the pukas, and, we can really get, that real, perspective, right? Because in Hawaii, we really value harmony over truth sometimes, well, a lot of times. And I think we really need to get truthful, and we need to push forward those things that are hard to do or hard to say. And we're happy to be that voice and push that forward. And so we're just look forward to more engagement.
Awesome, wonderful. Well, thank you so much, Lisa. I really appreciate just all of your knowledge and letting us know that these programs do exist, and we are working. I know a lot of us in the community may not really see all the work that you do, but we thank you so much and appreciate all of this effort that we put to not only have us get great access to care. So we thank you so much.
Oh, thank you. Yeah, it's kind of hard when you're out there with the shovel, dig in, because, the infrastructure underneath your house, you don't see all the pipes and stuff, right?
Yes.
But we've laid a lot of pipe, and I think now it's, we've laid a lot of seeds, and it's flowering, and, people are able to actually see and feel and touch it now, and it's making it very real. So I'm hopeful and super excited for a great 2022, and we'll keep pushing out information. So stay tuned.
Wonderful. All right, friends, you heard it. Stay tuned. Stay connected to your community and definitely participate. And we can definitely connect with one another to help the place that we live in. So thank you again so much. If anybody wants to ask questions, Lisa, if you could just stay on just for a few more minutes. I don't want to take up too much of your time. But yes, if there's any last questions that you've thought of, please put that in the Q&A box, and Lisa will be able to answer your questions as well. So we are moving on to the third segment of our talk story. We appreciate you guys hanging on with us. And I would like to introduce Lani Weigert, who is our Community Relations Manager for Hawaii Care Choices. If we could give her a virtual round of applause as she comes up and talks about the palliative and hospice care programs here at Hawaii Care Choices. Aloha, Lani. Oh, hold on, friends. Lani, you are on mute. It's 2022, but that's still the line.
Oh my gosh, we want to bury that line, but unfortunately, here we are. Anyway, oh my gosh, the rock stars that we had on today, Dr. Akiona and Lisa. What's so great about this kind of information is that knowledge is definitely power. And these talk stories, I tell you, that's really what's in our heart to put forth to you so that everybody can take personal responsibility for choices on their healthcare as well as for their family, and to be able to offer a front row seat to everybody on this presentation. I feel really honored because the information that Dr. Akiona and Lisa just shared with us, it's all the behind the scenes thing that we don't even know. I mean, how much did it resonate with all of you when Dr. Akiona says, hey, the people out on the street, They look like me. Oh my gosh, they sound like me. And, you know, it just really resonated in my heart that, gosh, you know, we're all one, you know, we're all one people. And then Lisa, who has just been pounding away at this effort of trying to get the staff that we need, the physicians, the nurses, bringing them to Hawaii Island so that we can get the quality care that we need. I mean, absolute rock stars. I so appreciate um, them sharing their challenges and also giving us the hope. And it's so refreshing to know that, hey, we can support them. We can write our letters to the legislature. You know, we can fill out the surveys. We can even be part of the solution by going on some of these groups, you know, and don't worry, we will have that information where you can sign up to be on one of these groups to really have your voice heard. I think that's really important, and I'm so impressed with the information they gave. We're truly grateful to both Lisa and Dr. Akiona for sharing all of that with us. So, hey, let's tie it all in to what we're gonna share today. You know, a lot of it is, you know, with palliative care and hospice care, we're giving this information to all of you. So again, you can make personal decisions for you and your family on when you might need access to this. And that was one of the big things that Dr. Akiona shared with us, is that equal access to quality care is one of the biggest challenges. But as long as you folks are on this journey with us, I tell you, you again will always have the front seat to all of this knowledge. So palliative care and hospice care, is it different? Yes, it is. There are a lot of similarities. And let me just share with you that on palliative care, it's really about relief. It's about bringing relief from all of the symptoms that sometimes happen when we're doing treatment, such as, say, if somebody has cancer and they're going out and they're having chemotherapy or radiation, there are always uncomfortable symptoms that come with that. And so we want you to know, with palliative care, not only can you take more of the responsibility on your choices, but you'll actually know what those choices are. And I think a lot of people just go, you know, through life in the dark and not really know. We're going to put everybody on this call and all of your family and friends right to the front row, because what this is all about is getting the right care at the right time. And just like Dr. Akiona says, if she tells them, hey, you know, I'll see you in 3 months, but something happens before then, everybody is still really trying to be good listeners and not call before then. Well, on palliative care, we have a team that actually will ride with you. And every time something comes up, you can tell us. We'll be right next to you on that. And so on hospice care, why is it different? Well, hospice care is really about not going out and getting treatments anymore. It's when comfort rises to the top. That's the number one thing that you are looking for. And hospice care delivers that in spades. Comfort is really where hospice care comes in at the top. And so by the time anybody wants hospice care, it isn't about giving hope. It's about no longer having treatments. It's about spending all the time with your family and loved ones. It's really about cherishing the time that we have together. And that's the huge difference. It's not doing any kind of treatments. You're really just trying to stay comfortable and be at peace with yourself. And so that's the difference. One is relief focused, one is comfort focused. And so people that are doing palliative care, I mean, they're still going Vegas and doing a lot of active things. For those who are on hospice care, they're not active as that because their focus is different. They're really, really cherishing every moment that they have together with their loved ones.
Awesome, Lani. Friends, if you understand that palliative care focuses on relief and hospice care focuses on comfort, give me a thumbs up or raise your hand.
Awesome. Thank you. Thank you. And I see that, Auntie Paulette has made a comment right there. That is so good. Auntie Paulette has been with us for a long time. She's on our presentation, and she's really been with us with all of her family as well. And so she's just very aware of palliative care and hospice care as well. So let's talk about, how they are the same. So both relieve suffering. And really, a lot of people will say, what is hospice? Hospice equals death. Actually, hospice was created to ease terminal suffering. That's what it was all about. But a lot of people just, they automatically think, oh, okay, I'm giving up hope if I go to hospice. Not at all. It's really, really about providing comfort and easing all of the suffering. So both have that in common. Both can be delivered at the patient's home or wherever they call home as well. And both improves the quality of life for the patient and the family. A lot of times, we had a situation where a husband and wife, the husband was very sick, but he said, no, I don't need any of that hospice care. My wife is here. But then when you looked at the wife, every time she would come in for an appointment with her husband, she continued to look more frail and more frail. And that's where I would tell the doctors, if the caregiver is starting to look frail, that's probably more the reason why they need the hospice care support. So again, come in as early as you possibly can, because we don't only help the patient, we help the family. And sometimes that makes all the difference in the world. So again, getting the right care at the right time. Do not hesitate. I do not understand why people will wait and say, oh, no, my mom's still eating. I'll wait till she can't eat or talk, then I'll call hospice. No, call us early so that you as a caregiver can be the husband, can be the son, can be the daughter, and not have to play the role as caregiver all the time as well. Why? Because our team will be there to help you folks. So again, we would come in, we'd create the plan of care, which we would all follow, so we'd all be on the same page. It's really the support that we give to everyone as our gift.
That's right. And friends, raise your hand if you think palliative and hospice care improves improves the quality of life for patients and their families.
So let's talk about how these two programs are different, palliative versus hospice care. So first of all, palliative care serves those that are dealing with serious illness, just like hospice, but it's further up the stream. And so those serious illnesses that I'm talking about is cancer of any type, congestive heart failure, any type of kidney failure as well, or COPD. And so with palliative care, oftentimes there are treatments associated with these types of illnesses. So when you have a team that's helping you to really manage all of that discomfort, it makes a huge amount of difference on boosting your quality of life. So again, that is palliative care. Hospice care, again, as I said, it's really focusing on comfort. And when comfort rises to the top as the number one priority, then that's where hospice care comes in. Again, there's a 6-month life expectancy that we get from your physician, but no more treatments, no more poking in the arm, no more having the, something else, inserted in your body. All of that goes away. And it's all about comfort and being with your loved ones.
Friends, give me a yes if you know someone that could benefit from hospice or palliative care. Lani, I also have a question that is coming from our audience. What is the difference in hospice care versus at home and in the facility?
Oh, okay. So I'm going to show you about our facility. It's Pohaima Lama. It's a very technically advanced facility that we have. Those who go to that facility, which is by all means not a long-term care facility, those who go there are those who are having symptoms that are not able to be managed at home. And so they come to Pohaima Lama, where we help manage those symptoms. And if they're able to go home, then they will go home. If not, if they're already well on their journey to end of life, then they will remain with us and they probably will pass there. I'd say, you know, the 95% of the people that come to Pohaimolama, most of them will pass there. And if you haven't seen Pohaimolama, I mean, it is the Mauna Lani of hospices. It is just so incredibly beautiful and cozy and warm. And so those that are at home, they are really choosing to be with their family. Their symptoms are able to be managed at home by both our care team as well as the family that cares for them. And so they're able to remain with their family all the way to the end of their days. So the difference is where they're at with regard to their symptoms. So if their symptoms cannot be managed at home, then we'll bring them to Pohaimolama and help manage those symptoms for them.
Wonderful. Thank you so much for clarifying that, Lani, for us.
Hey.
Oh, and there is our brain teaser. Okay, friends, it is up on your screen. The question is, how is palliative care and hospice care the same? Both relieve suffering, both can be delivered in patients' home, both improves the quality of life for patients and their families, both creates a plan of care, or all of the above. For those of you watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you. Feel free to put your answers right there in the comment box. Everyone is welcome to the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. All right, looks like we got our answers in. I'm going to go ahead and end the poll right there and share our results. So we have 6% said both improves the quality of life for patients and their families, and 94% said all of the above. Thank you so much for participating in our polls. Back to you, Lani.
Thank you so much. And all of those answers are correct. Definitely all of the above encompasses everything. And yes, you know, it does support and soothe the suffering of both the patient and family. So great. Thank you so much, everyone, for listening. That's really, really impressive. Yay, let's continue on. So signs that palliative care is needed. You know, I don't have a medical degree. I'm sure most of the people on this call does not either. So how would we even know if our loved one or even ourselves could use palliative care, could benefit from it? Well, these are some physical things that we can take a look at and know that maybe we could just give our physician a call and say, hey, this is happening to me. But obvious things like going to the emergency room several times, maybe in a month, that's definitely a lot, especially because most people either never go to the emergency room or they maybe go once in a whole year. Also, difficulty in managing medications, meaning there's so many medications that after a while we get confused as to which one we should take or not. And, you know, just daily activities, just regular things like going to the store, you know, that's becoming a real something to eat, or maybe even doing light housework. All of that's becoming really difficult. Why? Because, you know, maybe we don't have the energy for it. Maybe we want to stay in bed a lot. Maybe we find ourselves just sitting down all day. These kinds of unusual, maybe for you, would appear that it's time to call somebody and maybe get a checkup, or call us, because it's all about getting the right care at the right time. And then we can come in and do a free evaluation and let you know, yep, we can totally help you, or you got a few more months to go on that. So, you know, we'll circle back and check in on you. So again, you know, all of these kinds of physical, obvious things, you know, you have pain, but it's chronic. Every day it's there. You're always so tired, and the swelling in the feet and the legs, definitely give us a call, because we want to reach out and help you. We want you to help yourselves. And so that's what we're going to do.
Friends, raise your hand if you know anyone who's visiting or calling their doctors frequently.
So when should palliative care begin? You know, when we talk to our medical director, Dr. Dolan, she says right at diagnosis. So, you know, sometimes somebody will go in and maybe they got a diagnosis of breast cancer. So, maybe they don't see any symptoms, but the reason we want people to call us right away is because it's really scary. The psychological effect is taking hold immediately when those words are said, when we hear those very frightening words, you have cancer. It's like, call us. We want to be part of your support team. We want to, just get around the whole family and give you guys a nice big hug, because we can do this. We can do it together. So call us right away. And then by signing up early, if there's not any obvious symptoms going on, you kind of like are sitting at the side of the pool with your feet just dangling in the water. You're getting kind of acclimated to the idea of us coming to help you. And just like Dr. Akiona said, people are ashamed to ask for help and all that. We totally get you. You guys are our family. Of course, we know that you're going to act like that. Why? Because we act like that too. So you just call us early so we can get in there and help you.
All right, friends, we would like you to say true or false by signing up early for those with serious illnesses could live longer. Again, type true or false in that comment box or in the chat box below. All right, I do see everyone typing in true. Thank you so much for tuning in. Back to you, Lani.
So, for people who say, okay, well, what happens if I sign up for palliative care? So our team, actually, first our nurse will come on over to the house to do an evaluation, and then we'll ask some questions. Sometimes we come with our social worker too, which is also part of the team. And then we'll ask some of these questions here. The reason we're asking these questions is that we want to know if the doctor or anyone has even told you about your illness. I cannot even emphasize how often people are diagnosed with something. They either were never told that they were diagnosed, or they were never told what their illness is and what the symptoms are going to be or anything. So we want to come in because knowledge is power, and we want to make sure that every patient is equipped with all the knowledge that they need to make the choices that fit them personally, because it's really all about the choices. That's why we're Hawaii Care Choices. That's the number one priority that we want, is we want everybody to have their own personal choices. We also want to know who in the family makes the medical decisions. The reason we want to know that too is because lots of times we have family that live different islands. They might live on the mainland, etc. And then maybe that person that lives on the mainland comes home and then all of a sudden decides, no, mom's not going to do this or she's going to do that. But it's really important for mom to say who is the one that makes the decisions for her, whether it's herself or her daughter, whoever. It's important for us to know. We also want to know what are the regular practices that happen within the family, within the week, within the month, so that we can always help the patient be ready, whether maybe there's Bible study on Wednesday nights, whatever it is. We want to really be there to support the lifestyle of the family.
Is it important for you to understand about your illness, friends? Please type yes or no in the comment box. And I just like to say I appreciate everyone for staying on due to some technical difficulties we're having, but we are getting through on this Monday morning. Back to you, Lani.
Thank you so much, Tish. I love it. It's so good to have a sense of humor, as we continue on. Anyway, on the medication review, okay, so you see this couple over here, balancing all the jars of medication. This is no joke. We actually go to people's homes and their coffee table is filled with more than 50 jars of medication. Although I got to tell you, some, belongs to the deceased ex-husband, some belongs to their adult children that no longer live there. Some is expired medication. And then there's a whole bunch for them. Okay, so say the patient is taking, 35 different medications every day. Well, when our palliative care team comes in there, there'll be an immediate review of the medication, and then a consultation will be made with the primary care physician for the patient. And right there, you know, some of those medications are cut off. The reason that there's so many medications is because many of those who are seriously ill have more than one doctor. They're not only going to the primary care physician, you know, they're going to their cardiologist, they're going to whatever ologist there is, or then maybe they're going to urgent care, or some incident happens, they go up to the emergency room. Everybody's giving them medication. But, you know, sadly in our medication system, there isn't like an overview where it's saying, oh, this particular patient is getting this medication. It just comes fragmented. So when it does, then you have all of the jars of medication as you see this couple. And so maybe a person has 35 that they're taking every day, 35 different medications. But maybe in the end, after our review is done and the primary care physician is brought in the loop, maybe they're taking 18. 18 medications is so much better than 35 or 36. So I'm just saying that's part of what the palliative care team does. And, you know, right off the bat, 5% of the discomfort is gone. So, I mean, just for that, you want to call us just for that. So medication review is one of the main things that our palliative care team takes care of.
Thank you so much for explaining that, Lani. Friends, if you think medication review is important, please type yes in the chat box.
So other services that we provide from our palliative care. So our palliative care team will go out and our social worker will provide resources, information to resources, say big girls, big brothers, big sisters, you know, maybe there's kids in the house, or, you know, maybe to the food basket, because maybe there's a need to supplement, you know, the family's groceries. Whatever the situation is, the social worker on the team is amazing and can connect the patient and the family. And this is why I tell you, if you call us early, the family is getting all of the support. And that's so important, because if you wait, you could have got all this benefit, which, by the way, if your loved one or whoever it is that gets, you know, into the different programs, you know, a lot of this support is there when you come in. So again, call us early. And for those of you who don't have a advanced healthcare directive, if you're on one of our programs, you certainly will have the assistance of our social worker to ensure that you get an advanced healthcare directive. And I'll tell you in the next few slides why that is so important.
Right, friends, do you think these additional services increase the value of palliative care? Please type yes or no in the chat box. We want to hear from you.
So how is palliative and hospice care paid for? Everybody will ask that. So palliative care is paid for normally by Medicare. And if somebody is lucky enough to also have Medicaid, there'll be no co-payment at all. Now, for someone who has Medicare only, then there may be a copay to that. And the copay could be anywhere from $20 to $40 when the social worker visits or the provider. And only during those times. All the rest of the services are included in palliative care. So for hospice care, if it's hospice care at home, 100% of the services are included in the care that we provide, especially all of those that are connected to the diagnosis of which somebody comes into hospice care. So I tell you, even my mother, she had no idea about hospice care, but she thought for sure she's not going to have any of it, because she really believed that hospice equaled death. And so as far as she's concerned, when her doctor told us, hey, your mom can have hospice care home, she said, no way, I don't want any of that. You know, I'm going to live a long time. I don't need that. So when I told her, I said, oh, okay, mom, it sounds like you're not into this hospice care? She goes, no. I said, oh, too bad, because I heard we can get free stuff. Oh, really? Oh, no, I didn't know that. Like what? So when I explained to her that, the hospital bed, oxygen, other things that are needed later on in one's journey was already included, she was very, very open to the idea of, oh, okay, well, let's try it. And because of that, we did. And she was so very, very grateful as the months went on, because of course she did live past 6 months. And she reflected on the idea that my father, who had died 2 years earlier from congestive heart failure, did not have the benefit of hospice care, because we did not know that it was available to us. So I don't want that ever to happen to anybody, not at all. And when my mom was able to take the benefits, to really enjoy the benefits along with all of our family, I really understood why calling early made all the difference, because they not only educated us, our hospice team, but they really gave us a lot of support. And that's when my mom said, all of these people that live, our neighbors, etc., they'll never know about these hospice benefits. You go right out there right now and let them know. And I said, well, Mom, it's a little awkward, to let, the neighbors know that now, especially if they don't need the hospice services now. But then she said, okay, then you promise me later that you'll go and tell as many people as you can about these wonderful benefits for hospice care. And so that's why here I am. I'm telling you because I made a promise to my mother that I would. And there, I really, really want to make sure that every single one of you that's on the presentation today knows that that's why I'm telling you all of this. I want you to have it where other people might not know. You won't be one of those. And so how you're going to pay for it when it's time to have hospice care? You're not, because you're already going to be covered 100% hospice care at home.
Lani, thank you so much for sharing your story. It's always a pleasure to hear it. Friends, I just want to remind you that if you would like to ask Lani any of your questions, please use that Q&A box at the bottom of your screen.
So why hospice care? So in everybody's journey, their illness continues to advance. Naturally, it progresses. Well, on that journey, at some point, it's not about having all of these different treatments. It's not trying to get surgery for this, or, continue to get, blood tests for that, all of that. At some point, comfort just rises to the top. And that's the priority. It's to be comfortable, to have peace with oneself, and to really spend the quality time with loved ones. And that's when the focus really changes. It's not how long I'm going to live. It's really about how well I'm living each and every day. And that's where hospice comes in. Hospice really makes that difference. Also, a lot of people, like I said, they didn't understand why hospice care was created, but it was really created to ease terminal suffering. And why we're not allowed to go and help everybody on the island that would need us, we don't know. But it's word of mouth, one person telling another to call us here, and we will help. And also, a lot of people think that calling hospice is about giving up hope. Absolutely not. It's really about redefining what hope is for you personally. And that's what makes all the difference. And when people come on hospice care, they are getting the Cadillac of services, the highest level of care that anyone could ever need.
Friends, please let us know in the chat or the comment box if quality or quantity of life is what you want for your loved one.
So it takes a village, my friends. It absolutely takes a village. Do you see how we have a whole team over here? We have the physicians, we have the nurses, we have spiritual counselors, social worker, and then of course our wonderful, wonderful volunteers that come and serve as further witness to the journey of our lives. So again, this is why the right care at the right time. Do not wait for somebody to tell you. Please call us, because look at the whole team. We have a whole team of people waiting to come in. And believe me, we don't come in all at the same time, because like me, we don't like people coming over to our house. Same thing. You know, we call and then maybe one or two of us might come over. You know, in the end, because my mom was so like that too. Like, oh no, I don't like anyone coming over. You know, it's the type where, you know, you have somebody to clean up over at your house, but you're cleaning up before they come. It's that total same thing. Well, anyway, when they would come over, and it would be maybe one or two of them at a time, she really ended up building quite a deep relationship with each one, and she appreciated every moment that they spent with us. So again, sign up early so we can get that help coming your way.
Yes, and also raise your hand if you think early patient sign up ensures more support and quality of life, not only for the patients, but for families as well. All right, that is our brain teaser bell, friends. We have a question up on your screen. Early patient sign up ensures more support and quality of life for all, true or false? Again, those of you watching on Facebook Live, thank you so much for tuning in. You will not be able to see the polls pop up, but we still want to hear from you. Please type true or false in that comment box if you think early patient sign up ensures more support and quality of life for all. You can always join us in the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. I'm going to go ahead and end the poll right there and share our results. 100% of you said true. Amazing. Thank you so much for interacting with us. Back to you, Lani.
Great. Why that's so good is if you leave with nothing else, but at least that, sign up early. My day is made. I tell you, folks are just rock stars, all of you. Okay, so again, just like palliative care, how we don't have a medical degree, these are the reasons. These are the reasons that you would physically see of maybe I need to call my physicians or even call us if you think it's time for hospice care for yourself or a loved one. So these are the things: losing weight, not really hungry, don't want to drink any water, pretty much mostly staying in bed a lot, and, you know, not able to do a lot of the things that you're used to.
All right, friends, we would like to now share a personal story from patient caregivers.
Every single person in Kupu Care was like an angel. They were right on. They helped me. And then when it got really bad, and so the doctor finally acquiesced. But the doctors, I think, take too long to plug people into the home health care they need. He got hospice finally, and he was with them almost 2 weeks, and then he passed away. But I could have used them way before. And people need to be informed, you know, by the doctors about Kupu Care so they can get them plugged in to the help they need. Otherwise, you know, they're going to be in the situation I was in, which was pretty intense for quite some time. Thank God for Kupu Care, and all the people in hospice were angels. They were wonderful, beautiful people, beautiful, so supportive.
Well, one of the reasons why we went to Kupu Care was that my husband had found out that his illness was probably going to be progressive and not curable, so he was a little anxious, and so was I. During that time, you know, after he was diagnosed, his idea was spend as much time with the grandchildren so that they would be able to, I guess, remember. He had spent a lot of time with the community, and, you know, so he wanted to spend more time with family. And I think Kupu Care allowed him to do that. As far as quality of life goes, I think it was exactly what my husband, Barry, wanted.
So, these actual testimonials of people, they had to make choices for themselves. And that's what power we're giving to you folks, because knowledge is definitely power. And for you to make the choices for yourself or your loved ones, make them before somebody else has to make them for you. And sometimes, unfortunately, it could be later than you think. And so the Advanced Healthcare Directive here, this is so important. If there was ever a gift you could give your loved one, it's this. It's where, you're able to give instruction on something where you're not able to speak for yourself. And so the Advanced Healthcare Directive will kick in and it will give people direction on what you would like. So it's really important, if you're 18 years old or older, that you have one. And if you're on any of our programs, for sure, we'll make sure that you get one. But if you don't, this is something you can do.
Friends, let us know in the chat or comment box, do you have an Advanced Healthcare Directive?
So Community First is really an amazing organization that provides free workshops for people to get their Advanced Healthcare Directive. And I'm seeing after the workshop, people actually leave with the completed directive. And so here's the information here. Take down the phone number of contacting Amy or Rosemary, but definitely get connected to this group here. They are amazing. And get your Advanced Healthcare Directive if you don't have one, or maybe if you need to update yours, call them as well. They do an incredible job.
Yes, they absolutely do. I definitely see some of our audience members saying yes, that they do have an Advanced Healthcare Directive. Wonderful. That is amazing. For those of you that don't, I've put in the register online and the phone numbers for Amy or Rosemary all in that chat box as well once we advance the slide. Lani, I do have a question that is coming from our audience. Can
Sure.
someone with cognitive challenges, i.e. living with dementia, still use palliative care to manage symptoms of their other health conditions? In other words, if a patient cannot self-manage the care, can they still receive palliative care in coordination with a legal representative?
Yes, and that was a good question. And really, the operative word there is the other health challenges that they have. Normally, we're able to really leverage those other challenges to ensure that we can provide the overall care to someone with dementia or Alzheimer that might be out there needing the additional care. So yes, thank you very much.
Ooh, wonderful. Thank you, Lani, for answering that.
Okay, so some of you might wonder if you need this. Normally, those who are quite elderly, the difference with this one versus an Advanced Healthcare Directive, the Advanced Healthcare Directive provides a direction for your loved one. In this particular case, it provides an order to even EMS, anybody that comes to the house, or if you have some kind of incident with your loved one. The post will be something that you would put in a very obvious, noticeable place, like, on the refrigerator or something. This is an order that lets those who come, the ambulance people that come, that you do or do not want CPR. So this is very important. It's normally not for those who are younger, but those who have a serious illness and who are elderly and frail, they normally have a post.
Great. Friends, let us know, do you think you need a post? Type yes or no in that chat box. All right, there is that brain teaser bell again, friends. The question up on your screen is, where do I get my free Advanced Healthcare Directive completed or updated? Register online at communityfirsthawaii.org. Call Amy Hamane or Rosemary Burnett, or all of the above. Again, for those of you watching on Facebook Live, we so appreciate you sticking with us throughout this whole presentation. You will not be able to see the polls pop up, but we still want to hear from you. Feel free to email me at lopez@hawaiicarechoices.org and join us on our fully engaged Zoom presentation for next month, February 10th. All right, I am going to stop the poll right there and share the results. 100% of you said all of the above. Absolutely. Please call or visit their online registration page. Thank you so much. Back to you, Lani.
Thank you, my friends. Call them now. Call Amy and Rosemary. Those are totally my BFFs. They'll take care of you, so do not hesitate. So here we are at Pohai Malama. I was telling you about, this is our special inpatient facility. So again, people would only go here if the symptoms that they have cannot be managed at home, then they would come here. This again is not long-term care facility. It's only a short-term stay. And, you know, I'd say the average amount of time that people stay there is maybe 14 days. Room and board is not covered. Only the hospice care portion of the services is. So if somebody has Medicare and Medicaid, their room and board would be covered here as well. And then of course we would take private pay for people to stay here too.
Friends, please enjoy this short virtual tour of Pohai Malama.
Welcome to Hawaii Care Choices Pohai Malama, a Harry and Jeanette Weinberg Care Center. This is a state-of-the-art short-term care facility designed to feel like the most beautiful home you've ever been in. A spacious living room to gather your entire ohana together. The meditation room provides a beautiful space overlooking the gardens to find solace and quiet contemplation. Nothing feels more like home than gathering the family for dinner around the TV, which you can do in the family room while the keiki play in the room next door. Each suite is designed for maximum patient and visitor comfort with sleeping areas for guests, private bathroom facilities, and each room even comes with its own private lanai overlooking the lawn and gardens. When you or your loved one are in our care and you need some extra care, there's no place like Pohai Malama. For more information, call us at 808-969-1733 or visit us online at hawaiicarechoices.org.
Mahalo, Tish. Thank you so much for showing everybody Pohai Malama. That's just a quick walkthrough. So just letting you know that these are the areas in which we provide service. So anything on this slide that is colored is where we provide service. So it's from Lapohaihoi Point all the way to Ka'u, and we will cover all the points within as well.
Wonderful. Thank you, Lani, so much for sharing your story about your mom, for sharing about hospice and palliative care. I want to thank everyone so much who has joined us this morning, both on Facebook Live and our webinar today. If you have any specific questions about you or your loved one's situation, please feel free to raise your hand and I can take down your name and we will have someone special give you a call. If you don't have any questions today, but you think of one later, you can always connect with us by calling the number on the screen. We have a very helpful team standing by that will be so happy to answer your questions as well. A very special mahalo to our special guest speaker, Dr. Akiona and Elisa, for their valued time. I know they stayed on extra to answer multiple questions and their helpful perspectives and insights shared in today's healthcare talk story. Thank you again, Lani. I would just like to let everybody know, for those joining us on Zoom, there'll be a quick survey that will pop up on your screen soon. Please make the best selection possible for all 6 questions and then click the submit button below. It is anonymous and it will not be shared. Just wanted to let you know that. It should be up on your screen now. We would really love to get your feedback on our presentation today because your input will allow us to gain a better understanding of how we can best serve our community with presentations like these in the future. We definitely want to start 2022 strong. For those of you on Facebook, please send us your thumbs up or hearts if you enjoyed this presentation. Send a mahalo to all of our guest speakers. Lani, while they're doing their survey, I know we just have 1 more minute, but I just wanted to ask, what kind of challenges has COVID created for Hawaii Care Choices?
Well, one of the biggest challenges, of course, is to keep everyone safe and make sure that, you know, everyone is practicing social distancing, going into the homes and being outfitted with the proper protective gear, and just ensuring that we can get to the patients, having proper access to all of them during this time because it's so prevalent. So it's really about trying to keep everybody safe and still being able to maintain the same level of frequency to get in there and provide that really important care.
Wonderful. Thank you so much, Lani, for sharing that with all of us. Friends, if you feel that you have benefited from this presentation, please let your friends and family know that they are welcome to join us on the 10th of every month at 10 a.m. Just RSVP to myself for the Zoom link or tune into Facebook Live. Again, that is the 10th of every month at 10 a.m. I'd like to say mahalo again for all of you that are joining us. And we hope to see you next month on our next healthcare talk story. I'm going to go ahead and end the survey right there. I so appreciate your feedback. And I hope you have a beautiful Monday. Aloha.
Aloha, everyone.